Some positive news on the COVID front tonight. Overall cases and deaths continue to decline across the country, which coincides with a rise in vaccinations. Tonight, though, we're looking into the issue of natural immunity. Here's what former COVID testing czar with the Trump administration, Dr. Brett Giroir, told us about that last night.
There are no data that prove that vaccine immunity is superior to natural immunity. That just doesn't exist, and in fact, there are much data to the contrary. That being said, even if you have natural immunity, if you get a vaccine, you can be even super protected. So for people who are not undergoing a transplant, I think the data are clear. Natural immunity is powerful and should be an option to vaccines for those who don't want to get the vaccine for any reason.
Let's bring in now immunologist and public health advocate, Dr. Hooman Noorchashm. Doctor, you and I talked about this, I don't know, maybe it was a month or so ago.
Hey, Joe.
I'm sure that is sort of nice to see your thoughts echoed by the doctor there. Why are we not hearing more about this on the national stage?
Well, I think it's absolutely disappointing that the Biden administration is not embracing this issue. There are literally millions of Americans who are COVID recovered. They're serologically immune, and the preponderance of evidence, really, and very solid evidence, is demonstrating that these folks are equally, if not better, protected from subsequent infection compared to people who are, fully vaccinated and COVID naive. So I think it's a dramatic mistake. In fact, today, the President of the United States, in his speech in Illinois, again reiterated this idea that this is a pandemic of the unvaccinated. I would qualify that by saying that, in fact, this is a pandemic of the unimmune, Mr. President. And I think that this is a critical difference. As you know, there are, in fact, people who are fully vaccinated who are ending up infected. These are folks who are actually unimmune despite the fact that they're fully vaccinated. And that's the simplest, most likely explanation. We already know that anywhere from 10 to 30% of people who are vaccinated either with Johnson & Johnson or the mRNA vaccine are actually not effectively immunized. Those are the numbers that the companies themselves advertise. So this idea that this is a pandemic of the unvaccinated is actually dangerous, because in the same setting, the United States Food and Drug Administration has actually blocked the pathway to getting antibody tested. There's an advisory on May 19th, 2021, where the FDA discourages Americans from getting their immunity checked. This is a mistake.
Well, that's the whole idea. If you get the antibody test, then you know. But I have a question for you on that, doctor. If that's the case, why is it that every state and every statistic I see shows that 90% plus of the people either sick, hospitalized, or dying are unvaccinated?
Well, I think that's absolutely right. There are a lot of folks who are not vaccinated and are not immune. But they're also, on the flip side of it, as I said, with the millions of Americans who've actually been vaccinated with a vaccine that has an efficacy rate anywhere from 10 to 30%, there are going to be a lot of folks who are actually fully vaccinated and not immune. So I think what we can do here is we can walk and chew gum at the same time. Really, the focus should be immunity. And the solution is not to block Americans from knowing the status of their personal immunity. The solution is to actually encourage people to check their immunity. In my own practice, whenever I've shown people that they have no antibody immunity, I've been able to convince some vaccine hesitant, some people who are on the fence about vaccination, to get vaccinated. I would say 50% of people who see that they're not immune go ahead and go get vaccinated. And this is in my experience. On the flip side of it, I've also seen, Joe, people who are fully vaccinated with very low levels of antibodies or no antibodies. And these people are the people who are very confident about being fully immune from their vaccine, but in fact are not. So I think we really should take a more nuanced approach. Unfortunately, the President of the United States is not taking a very nuanced approach. I think he's getting some very bad advice from his advisors regarding immunity. I think our focus should be immunity, not vaccination per se.
Let's play another clip from Dr. Giroir last night about the Delta variant after former FDA Chief Dr. Scott Gottlieb said it would likely be the last wave. Here's the clip.
I do believe we have had a turning point. Delta was so contagious that it swept through the susceptible population, all those who had not gotten a vaccine and all those who had never had COVID before. Remember, we were having, even though they reported 100,000 cases a day, it was more like 500,000 cases a day. So I do believe the virus is burning out all the susceptible individuals.
So what do you make of this, doctor? Do you think we've made a turning point here?
Look, I don't know. I think that's pure speculation. What is a safe bet is that somewhere around 30% of the American population is still unimmune. And I think as our furnaces go on this fall and winter, as people go indoors, I think we can expect that we're going to see flares, especially in parts of the country where immunity rates are low. And these are both going to be folks who are vaccinated and unvaccinated, unimmune. You remember the example up in Barnstable, Massachusetts, where the large population of folks ended up vaccinated, but ended up in the hospital with infections. This is actually the problem. The problem is that we need to be focused on immunity. Instead, the Biden administration's focused on a one-size-fits-all vaccination and ignores, frankly, about 100 million Americans who are already immune. And all the data is showing that these folks are equally, if not better, protected from reinfection. It's really tearing this country apart, and I think it's a serious mistake on the part of the administration.
You mentioned
that can correct it.
The president is in Chicago today, and he's talking about the effectiveness of the vaccine and also of mandates, which I think are borne out in the numbers. 95 million eligible Americans were unvaccinated when the president announced his mandate last month, and now it's down to 67 million. So it's effective, to your point. Do you think that's why we're seeing a decrease in the number of cases and also in the number of deaths, even though we're still losing 1,800 people a day?
Look, I think as time goes on, folks are going to get immune, either through natural immunity or through vaccination. There's no question about that. I think the pandemic is going to burn itself out, hopefully before the summer of 23. But I think that the president is actually using these rigid mandates is really creating a crisis for himself politically, frankly, downstream, as well as a public health crisis, because people are feeling coerced. I think there's a large number of folks who are vaccine hesitant or are on the fence about the vaccine who are COVID recovered. And, everything we know about immunology and common sense tells us that, look, if I just had a whopping case of COVID, why should I go get this vaccine that has a certain incidence of complications? Now, the incidence of complications is low, but if you're COVID recovered and you're protected, you subjecting yourself to that risk is actually a risk of harm. And I think the president doesn't really understand this. I really genuinely believe that he's getting some bad advice from his advisors, and I sincerely hope that everyone in the Biden administration could actually level with the American people and amongst themselves and really take an honest look at the natural immunity data set. It really is tearing this country apart, and really, I can't tell you the number of emails I get every day from federal employee, from private employee who are COVID recovered and they demonstrate natural immunity, but they're being forced, at the risk of coercion, losing their employment opportunities, educational opportunities. It's really horrific to see this country getting torn apart like this by the executive branch.
Immunologist and public health advocate Dr. Hooman Noorchashm. Doctor, thanks again for your time joining us.